30-year-old woman saw her GP with increasing toothache. She was referred to the local hospital for a formal OPG. This demonstrated a mixed lytic and sclerotic mass centered on the apex of the right lower canine. What is the likely diagnosis? A. Odontogenic cyst. B. Apical cysts, brown tumors, odontogenic cysts, and metastasis are all lyric lesions. Cementomas arise in the apex of a vital tooth and are mixed lyric and sclerotic masses. They are often multicentric, typically affect people aged between 30 and 40, and are more common in women. Apical cyst. C. Cementoma. D. Brown tumor. E. Metastasis. 2a. Multilocular. Multilocular cystic lesion with expansile scalloped margins is seen lying adjacent to the right lower first molar on an OPG of a 30-year-old woman. The cyst has thin septate margins and the root of the molar is absorbed. What is the likely diagnosis? A brown tumor. B. Metastasis. C. Dentigerous cyst. D. Apical cyst. E. Ameloblastoma. 3. A 65-year-old known arteriopath was admitted via the emergency clinic with new onset right-sided homonym. 2. Answer E. Ameloblastoma. Ameloblastoma, or adamantinoma, of the jaw are benign locally aggressive neoplasms. They usually affect people aged between 30 and 50 years of age and are slow-growing lesions that typically affect the lower premolars and molars. They are multilocular expansile masses and are associated with resorption of the root of the teeth. Apical cysts are usually unilocular and dentigerous cysts are associated with the cap of the tooth. The lesion described has generally benign features and is unlikely to be a metastasis. Homonymous hemianopsia. What part of the optic pathway is most likely to be affected? A. Left optic tract. B. Right primary visual cortex. C. Right optic radiation. D. Optic chiasm. E. Left optic nerve. For A42. Three. Answer A. Left optic tract. Monocular visual loss is due to a defect in the optic nerve. Bitemporal hemianopia is due to a defect at the optic chiasm level. A homonymous hemianopia is caused by a defect in the contralateral optic tract or through all the contralateral optic radiation. Right upper outer quadrantanopia. Quadrantanopia is due to a defect in part of the optic radiation. Central. Central bilateral homonymous hemianopia is due to a defect in the contralateral primary visual cortex. Forty-two-year-old female is seen in the emergency eye clinic with a left-sided proptosis and chemosis. What features on imaging make thyroid eye disease more likely than pseudotumor? A. Intraconal fat haziness. Haziness. B. Enhancement of the fat. C. Thickening and enhancement of Tenon's capsule. Fascia bulbi. D. Lacrimal gland enlargement. E. Swelling limited to the muscle bellies of the recti muscles. 5. A44 year. 4. Answer E. Swelling of the rectus muscles and levator palpebral only. Thyroid eye disease is limited to the muscle bellies of rectus and levator palpebral muscles, and Tenon's capsule tends to be spared. This is not the case in pseudotumor. Fat haziness is seen in both thyroid eye disease and pseudotumor. In pseudotumor, there is enhancement of the fat with contrast, and lacrimal gland enlargement occurs in 5% of cases. 5. Forty-four-year-old hyperthyroid woman develops chemosis, proptosis, and lid lag affecting the right eye. She underwent a CT. Which orbital muscle is the most commonly affected? A. Lateral rectus. B. Superior rectus. C. Medial rectus. D. Inferior oblique. E. Inferior rectus. 6. A34. 5. Answer E. Inferior rectus. This patient has Graves' eye disease, which is an autoimmune disorder caused by long-acting thyroid stimulating factor. It is commonly bilateral, 75%, and results in hypertrophy of the muscle belly with sparing of the tendon insertions. The most commonly affected muscle is the inferior rectus, followed by the medial, superior, and then the lateral recti. 6. Answer E. 34-year-old male with known Burkitt's lymphoma has a new right-sided proptosis. Where is the most likely site of the lymphoma to deposit? A. Rectus muscles. B. Bony destruction of the sphenoid wing. C. Intraconal. D. Intraorbital. E. Lacrimal gland. 7. A 76-year-old man with E. Lacrimal gland. Orbital lymphoma is typically non-Hodgkin's B-cell lymphoma and occurs in middle age. It is usually associated with lymphoma 2 deposits elsewhere in the body. The most common site is extraconal within the lacrimal glands. On imaging, lymphoma within the lacrimal gland is usually seen as well-defined high-density mass. with deranged liver enzymes underwent an MRI for investigation of a possible cerebrovascular event. On T1, weighted MR he was noted to have an incidental 0.5 cm high signal lesion in his right choroid. Apart from age-related small vessel changes within the periventricular white matter, the rest of the MRI was within normal limits. What is the most likely diagnosis? A hemorrhagic cysts, choroidal lipomas, Schizocephaly rings D melanoma, E foreign body. Mass. 7 answer D, melanoma. This patient has metastatic uveal melanoma. Medical students are always taught beware of the man with the glass eye and the large liver. Uveal melanoma is the most common primary intraocular neoplasm in adults. It occurs in patients aged 50 to 70 and is usually choroidal and unilateral. On MRI the lesion is of high signal on T1, weighted images, and it is hyperdense on CT. These lesions metastasize to the lung, liver and optic nerve and prognosis is poor. Body 8A patient with suspected Alzheimer's presence with memory impairment, personality change, and mild but definite cogwheel rigidity. The referrer is keen to start Alzheimer's therapy soon due to the high clinical suspicion and success rate of early therapy. Out of the following options, which is the best investigation to ensure therapy will not exacerbate a Parkinsonian crisis? A CT scan D to TSCAN CTC, 99 MHMBOW brain scan D MRI scan D PET CT, with FDG 9 and 18. Poor. 8 answer B, the TSCAN. Schizophrenia therapy can produce Parkinson's-like symptoms, and if there are equivocal changes on the TSCAN, treatment should be used with caution. The only way to assess presynaptic receptors for dopaminergic uptake is with the TSCAN. Month-old child with Turner syndrome presented to the pediatric outpatient department following the sudden appearance of a large fluctuant mass in the posterior triangle of the neck. An MRI study revealed a multiloculated mass posterior to sternocleidomastoid on the left side, which was hypointense on T1, weighted imaging, and of increased signal intensity on AT2, weighted sequence. CT scan showed the lesion to be hypodense. What is the most likely diagnosis? A branchial cleft cyst B cystic hygroma C ranula D thyroglossal duct cyst E leiomyoma 10 A24. The TSCAN. 9 answer B, cystic hygroma. A cystic hygroma is the most common form of congenital malformation of the lymphatic system and usually presents within the first 2 years of life. On clinical examination it is a compressible mobile mass in the posterior triangle and is composed of a honeycomb of loculated cystic structures. On CT it is a well-defined mass of low attenuation, which does not appear to contain a surrounding wall and, if large, can result in mass effect. Characteristically, cystic hygromas are hypointense on TI and hyperintense on T2, weighted MRI with no enhancement with contrast. They have been related to a range of syndromes, most commonly Turner's. It may be difficult to distinguish radiologically between a cystic hygroma and a third branchial cleft cyst. The latter possesses a thin wall, is seen just posterior to the carotid artery, and a sinus opening should be visible on examination. A ranula is seen either in the sublingual or submandibular space. A thyroglossal cyst is a midline structure. Old patient presented with a painless lump in the right submandibular region, which had been present for 3 years, and had been gradually increasing in size, now measuring 1.5 centimeters. AFNA revealed features suggestive of a submandibular pleomorphic adenoma. What are the most likely imaging characteristics? A isointense to muscle on T1W MRI B hypointense to muscle on T2W C poor enhancement post gadolinium D A smooth margin E areas of calcification on CT11. Structure. 10 answer A, isointense to muscle on T1W MRI. Pleomorphic adenomas are benign lesions containing both mesodermal and glandular tissue. They most commonly occur in the parotid gland, but can also arise within the other minor salivary glands. On CT they are generally well demarcated, homogeneous and slightly hyperdense to muscle. Typically, there is no significant enhancement post-contrast. On MRI they are isointense to muscle on TI, and become hyperintense on T2, weighted images with avid enhancement post-gadolinium. Adenomas of less than 0.5 centimeters tend to have a smooth margin while larger lesions may appear more lobulated. 80% of all pleomorphic tumors occur in the parotid gland, and of these 80% occur in the superficial lobe. Old female exhibited painless facial asymmetry, which had been progressing since birth, and for which she had undergone multiple surgical procedures with reconstruction. CT findings revealed expansion of the medullary cavity of the left maxillary bone with a ground glass appearance. The skull base was also imaged and the neural foramina were not involved. The lesion was hypointense on both TI and T2 weighted images. What is the most likely diagnosis? A Paget's disease v. Noonan syndrome C. Ossifying fibroma D. Fibrous dysplasia E. Osteogenesis imperfecta 12 The posterior lobe. 11 Answer D. Fibrous dysplasia. Fibrous dysplasia is a pathology of unknown etiology and usually occurs before 30 years of age. It involves increased proliferation of woven bone within the medullary cavity that cannot develop to lamellar bone and is most commonly monostotic but can be polyostotic. Bone expansion resulting in facial deformity can occur and malignant transformation has been described 0.5%. If the skull base is affected, the neural foraminae can become stenosed. Stenosed. The radiological appearances are diverse dependent on the degree of fibrous tissue produced. A CT scan characteristically reveals an expansile bony lesion that displays ground glass density. The bony expansion can be identified as a result of widening of the medullary space with the cortex remaining intact. MRI usually shows a low signal intensity on both TI and T2 weighted images and intense enhancement following administration of contrast. Polyostotic fibrous dysplasia is a feature of Albright syndrome, cutaneous pigmentation, fibrous dysplasia, and precocious puberty. Puberty. Paget's disease produces mixed lyric and sclerotic lesions, is more common in males, primarily involves the vertebrae and skull, and occurs later in life. Ossifying fibromas are more focal, displaying discrete zones of osseous or fibrous tissue, and behaving more aggressively. Posterior triangle of the neck is divided anatomically into the supraclavicular and occipital triangles by which structure. A posterior belly of Digges trick. The inferior belly of omohyoid C. vagus nerve D. Anterior scalene E. clavicular head of sternocleidomastoid 13. Aggressively. 12 Answer B. Inferior belly of omohyoid. The boundaries of the posterior triangle are formed anteriorly by the posterior border of sternocleidomastoid, inferiorly by the middle third of the clavicle, and posteriorly by the anterior border of trapezius. The posterior triangle is bisected by the inferior belly of omohyoid approximately 2.5 centimeters above the clavicle, creating an occipital triangle superiorly and a supraclavicular triangle inferiorly. 13. A 68-year-old male with no previous psychiatric history was referred with declining memory and confusion. A CT showed patchy low density in the deep white matter with marked generalized atrophy and multiple small well-defined areas of low density, which lacked mass effect. He was then referred for a radionuclide Hemorrhage scan which demonstrated reduced perfusion to the superior parieto-temporal cortices bilaterally. What is the most likely diagnosis? A frontotemporal dementia with concurrent vascular disease, the Alzheimer's disease/DLB, dementia of the Lewy body type, probably secondary to vascular pathology. See a mixed pattern of Alzheimer's/DLB type and vascular dementia. D. Drug-induced Parkinson's disease. E. Mesial temporal sclerosis. 14. A 42-year. Inferiorly. 13. Answer C. A mixed pattern of Alzheimer's/DLB type and vascular dementia. Alzheimer's and dementia of the Lewy body type do not have a vascular etiology, but may coexist with vascular dementia. Mesial temporal sclerosis is a form of epilepsy diagnosed clinically and is best imaged on MRI. Frontotemporal dementia presents differently and imaging shows frontal and temporal lobe changes. 42-year-old smoker presented with right arm weakness and left-sided ptosis with a constricted left pupil. A contrast-enhanced CT of his neck was performed. What is the most likely appearance of the carotid arteries? A normal appearance on left B, luminal narrowing on left C, double lumen sign, on right D, double lumen sign. Changes. 14. Answer B, luminal narrowing on left. The most common site of an extracranial internal carotid artery dissection is the segment of vessel just distal to the carotid bifurcation. The most common finding on angiography is that of a tapered luminal narrowing and associated enlargement of the diameter of the dissected vessel. If there is a severe stenosis, then a string sign can be seen. An intimal flap is frequently not identified in internal carotid artery dissections, and therefore the characteristic double lumen sign is not usually seen. On CT, the eccentric rim of intramural hematoma does not usually enhance, but on MRI it can display increased signal intensity on T1 weighted images as a result of the methemoglobin content, although fat suppression imaging is needed in order to differentiate the intramural hematoma from surrounding periarterial fat. The rim of intramural hematoma may not exhibit hyperintensity in the first few days after dissection, as it contains primarily deoxyhemoglobin and will therefore be isointense with the surrounding muscle. Partial ptosis and constricted pupil are components of Horner's syndrome due to interruption in the sympathetic nerve supply. Illuminal narrowing on right 15, a 66-year-old man with a history of chronic schizophrenia, for which he receives medication, presents to the neurologists with recent onset tremor and apathy. A DTSCAN shows bilateral comma-shaped tracer uptake in the striatal pathways. CT shows ill-defined low density in the periventricular deep white matter with a mild degree of atrophy. What is the most appropriate preliminary diagnosis at this stage? A. Idiopathic Parkinson's disease. B. Vascular dementia. C. Drug-induced Parkinsonian syndrome. D. Early onset Alzheimer's disease. E. Depression 16, a 59. 15. Answer C. Drug-induced Parkinsonian syndrome. Surrounding muscle. Partial ptosis and constricted pupil are components of Horner's syndrome due to interruption in the sympathetic nerve supply. 15. Answer C. Drug-induced Parkinsonian syndrome. The DTSCAN is normal, hence there is no evidence of idiopathic Parkinson's disease, but this study will not exclude drug-induced symptoms, which are caused by blockade of postsynaptic receptors. The treatment of schizophrenia includes drugs, which can produce a Parkinson's-like syndrome. Early onset Alzheimer's refers to patients under 60 years old. The symptoms and investigation are not compatible with this diagnosis. Depression is also feasible. 16. Answer A. Hyperparathyroidism secondary to parathyroid adenoma. This 59-year-old lady is being investigated for hypercalcemia after being referred with general malaise, weight loss and bone pain. A whole body bone scan demonstrates markedly increased and diffuse tracer uptake in the appendicular skeleton with increased bone to soft tissue ratio and absent renal uptake. Plain films show speckled soft tissue calcification. An ultrasound of the neck shows a small low reflectivity lesion posterior to the right lobe of the thyroid. What is the likely explanation for the bone scan appearances? A. Hyperparathyroidism secondary to parathyroid adenoma. B. Widespread metastases with metastatic deposits in nodes in the neck. C. Renal osteodystrophy. D. Myeloproliferative disease. E. Hyperthyroidism with a multinodular goiter 17, a 50. 'This appearance is a superscan. Causes include widespread metastatic disease, renal osteodystrophy, osteomalacia, hyperparathyroidism. Hyperparathyroidism, hyperthyroidism, myeloproliferative disorders, Waldenström's macroglobulinemia, mastocytosis, and Paget's disease. The probable parathyroid adenoma makes this the likely cause. 55-year-old woman is being treated for hyperthyroidism using I-131. How soon after it is ingested should imaging be performed? A within 30 minutes, B 1 to 2 hours, C 6 hours, D 24 hours, E 1 week 18, A 28 year. This appearance is a superscan. Causes include widespread metastatic disease, renal osteodystrophy, adenoma makes this the likely cause. 17 answer D, 24 hours. I-131 has a half-life of 8 days and is usually taken as an oral preparation for the treatment of hyperthyroidism. Patients are typically imaged 24 hours after ingesting the I-131. Antithyroid drugs are stopped 6 weeks before treatment to ensure maximum uptake of I-131. Patients can remain on symptomatic management, such as beta-blocker type drugs, to reduce symptoms. The peak energy of 1,131 is 364 keV, and the absorbed dose is 50-100 cgy rad. 1,123 has a half-life of 13 hours and is ingested orally. Imaging is typically performed after 6 hours. The peak energy is 159 keV, and the absorbed dose is 2 to 5 cgy rad. 18 18 Answer C. LE43. 8-year-old man presents to accident and emergency following trauma to the nasal bridge and upper maxilla. Examination revealed the maxilla to be displaced posteriorly, causing an anterior bite. Facial views reveal a fracture line extending across the nasofrontal and frontomaxillary sutures. On CT, the fracture passes through the medial wall of the orbit, through the nasal lock, rhymal groove, and ethmoid bones, and along the floor and lateral orbital wall to the zygomatico-frontal junction and the zygomatic arch. A branch of the fracture extends through ethmoid, vama, pterygoid plates, and to the base of the sphenoid. What type of fracture is this? A. LE4 fracture. B. LE42 fracture. C. LE43 fracture. D. Orbital blowout fracture. E. Tripod. 3. All LE4 fractures involve the pterygoid process. LE4I is a transverse fracture through the maxilla. LE42 is more extensive and the separated fragment is pyramidal, while in LE43 there is complete craniofacial disjunction. In practice, fractures do not fit these descriptions exactly and may be asymmetrical or coexist. The classification is still in general use and aids in subsequent surgical management. In LE4I and 2 the fractured maxillary fragment is usually wired to the zygomatic arches, but if these are fractured as in LE43, a more complex pin and rod fixation to the skull vault is undertaken. Tripod fracture. 19 A23 year old man presents to the emergency department following a fight, is assessed and diagnosed with a right-sided tripod fracture. No other facial fractures are apparent. How many of McGregor's lines are disrupted? A none. BLC2D3 E420 A58. Undertaken. 19 Answer D. 3. All 3 lines. McGregor's lines are 3 transverse lines visible on frontal views of the facial bones. A tripod fracture would disrupt the first line around the zygomatico-frontal suture, and would disrupt the second and third lines twice. Both would be disrupted over the zygomatic arch. The second would be disrupted again at the inferior orbital rim, and the third at the inferior rim of the maxillary antrum. '58-year-old man presented with a 2-year history of a painless palpable swelling in the region of his left carotid. On examination, the mass was mobile and superficial to his facial nerve. Imaging with MR revealed a septate well-defined mass in the parotid tail. On T1, weighted sequences, it was of low signal relative to the parotid gland, and enhanced with contrast. On T2, weighted imaging, the mass was of heterogeneously high signal. What is the most likely diagnosis? A Warthin's 2 fracture would disrupt the first line around the zygomatico-frontal suture, and would disrupt the second and third lines twice. Both would be disrupted over the zygomatic arch. The second would be disrupted again at the inferior orbital rim, and the third at the inferior rim of the maxillary antrum. 20 Answer A. Warthin's tumor. The description given is typical of the imaging appearance. Sialadenitis is usually caused by streptococcus or Haemophilus infections and typically produces inflammatory change within the gland and subcutaneous tissue edema. Sialectasia does occur. Mucoepidermoid cancers are poorly defined lesions lacking enhancement, which in perineural spread may be visible particularly on T2 weighted images. Sjogren's syndrome is commonly bilateral. The most common imaging feature is multiple small cysts in an enlarged parotid gland. B. Siladenitis. C. Lipoma. D. Mucoepidermoid carcinoma. E. Sjogren's syndrome. 21A60. Year. Old woman presents with a painless mastoid swelling. Investigations reveal a mixed hearing loss. CT shows a coarsening of the trabeculae with cortical expansion and thickening. What is the most likely diagnosis? A Paget's disease. B. Osteomyelitis of skull base. C. Ossifying fibroma. D. Polyostotic fibrous dysplasia. E. Monostotic fibrous dysplasia. Gland. 21. Answer A. Paget's disease. Paget's disease presents with a mixed hearing loss due to fixation of the stapes in the oval window, giving a conductive deficit, and loss of cochlear bone density, producing a sensorineural deficit. Both monostotic and polyostotic fibrous dysplasia normally present as an incidental finding in a young age group with a classical ground glass appearance on CT. The clinical picture does not fit with a potential diagnosis of osteomyelitis. Typical CT appearances of ossifying fibroma are of a cortically based lyric lesion with a thick bony rim in a young patient. Dysplasia 22A35, year, old pregnant female with a family history of deafness presented with accelerated hearing loss. Otological examination was unremarkable, and audiological assessment confirmed a mixed hearing loss primarily affecting the higher frequencies. A working diagnosis of cochlear otosclerosis was postulated. What classical finding would you expect to see on CT? A ring of low density around the cochlea. Cochlea. B. Hypersclerosis of a poorly pneumatized mastoid. C. Ossification of the oval window. D. Hypodense opacity of the mesotympanum without bony erosion. E. Acicular destruction and bony scalloping. 23A40. Patient. 22. Answer A. A ring of low density around the cochlea. The double ring sign is due to demineralization of the surrounding bone, and is a classical finding in cochlear otosclerosis. Hypersclerosis of a poorly pneumatized mastoid is most likely to represent mastoiditis, while ossification of the oval window would support a diagnosis of fenstral sclerosis. Hypodense opacity of the mesotympanum without bony erosion is suggestive of chronic otitis media, while acicular destruction and bony scalloping could represent cholesteatoma. 40-year-old male presents to his GP with a gradual onset of increasing dizziness. Investigations in the Ent clinic reveal a sensorineural hearing loss and gradual hemifacial spasm. Imaging studies revealed a lesion in the cerebellopontine cistern with low TI and high T2 signal similar to that of the CSE. It was of high signal on flare sequences. What is the most likely diagnosis? Answer A, epidermoid. The most important differential for an epidermoid here is an arachnoid cyst. On flare, fluid-attenuated inversion recovery, i.e. a water-suppressed pulse technique sequences, an arachnoid cyst will be low signal similar to that of stationary water while epidermoids are high signal. These could also be differentiated by diffusion-weighted MR. Both an acoustic neuroma and a cystic meningioma would have areas of enhancement on T1 weighted images. ECPA aneurysm 24A 40-year-old patient has unilateral pulsatile tinnitus. Audiometry reveals a conductive hearing loss on that side. Otoscopy shows a vascular retrotime, canic mass lying behind the inferior tympanic membrane, and CT reveals a tubular mass crossing the middle ear cavity from posterior to anterior with no associated bone changes, although there is an enlarged inferior tympanic canaliculus. What is the most likely diagnosis? A. Aberrant internal carotid artery. B. Dehiscent jugular bulb. C. Glomus. Glomus tympanicum. D. Glomus jugulotympanicum. E. Cholesterol granuloma. 25A. Images. 24. Answer A. Aberrant internal carotid artery. The most important feature on CT imaging is whether the lesion is of a tubular nature. This would steer you away from a diagnosis of glomus tympanicum and should prevent you a dangerous biopsy. A glomus tumor would show permeative bone changes, and a dehiscent jugular bulb would also most likely show focal absence of the jugular plate. Answer B. Septum pellucidum. A 1-month-old hypotonic baby was morphologically abnormal. He had a cleft lip and hypotalarism. A CT demonstrated fused thalami, a large monoventricle, agenesis of the corpus callosum, absence of the falx cerebri, and interhemispheric fissure. What further structure is most likely to be absent? A pituitary. B. Septum pellucidum. C. Septum virgae. D. Olfactory nerves. E. Optic nerves. 26A 14. Pellucidum. This patient has holoprosencephaly, which is always associated with an absent septum pellucidum. Holoprosencephaly is a failure or incomplete cleavage of the cerebral hemispheres. There are 3 types. A lobar, the most severe form, which typically results in death below 1 year of age. There is a large single ventricle with a peripheral layer of cerebral cortex. No third ventricle, falx cerebri, interhemispheric fissure, corpus callosum, septum pellucidum, olfactory, or optic nerves are present. The thalami are fused. Fused. Semilobar is a milder form and children may reach adulthood. There is a single ventricle with partially formed occipital horns and minimally developed temporal horns. There is partial fusion of the thalami, a small third ventricle and rudimentary falx cerebri. Cerebri. Lobar, mildest form where there is separation of the cerebral hemispheres. There are 2 cerebral hemispheres and 2 lateral ventricles. The frontal lobes are dysplastic and there is a single fused frontal horn. The thalami are separated. 14-year-old boy with recurrent fits since birth undergoes an MRI. On T2, weighted images there is gyriform, low signal intensity changes with associated atrophy affecting the left occipital lobe. On T1, weighted contrast enhanced images there is enhancement of the leptomeninges. What other feature is likely on MRI? A right 6 venous angioma 2 lesion B left V2 venous angioma 2 lesion C left occipital skull vault thinning D ipsilateral enlargement of the choroid plexus EK Vernoma 27 a 15-month old child was being investigated for chronic fit. Fits. On TI and T2, weight. Separated. 26 Answer D, ipsilateral enlargement of the choroid plexus. This child has Sturge-Weber-Dimitri syndrome, which is associated with a facial port wine stain, telangiectasia of the trigeminal nerve, and a leptomeningeal venous angioma. The leptomeningeal venous angioma is most commonly in the parietal lobe. It is associated with atrophy of the underlying cortex, thickening of the overlying skull vault, and enlargement of the choroid plexus. There is gyriform cortical calcification, which can sometimes be seen on plain film. Angiomas may be seen in most visceral organs of the body. Weighted MRI. A gray matter cleft extends from the surface of the right temporal horn of the lateral ventricle to the parietal lobe cortex. CSF signal is seen within this cleft. The corpus callosum is present but the septum pellucidum is absent. What is the diagnosis? A. Open lip schizencephaly. B. Lobar holoprosencephaly. C. Poencephaly. Cyst. D. Closed lip schizencephaly. E. Burr hole tract 28 A 26. Cortex, thickening of the overlying skull vault, and enlargement of the choroid plexus. There is gyriform cortical calcification, which can sometimes be seen on plain film. Angiomas may be seen in most visceral organs of the body. 27 Answer A. Open lip schizencephaly. Schizencephaly is a cleft extending from the lateral ventricle to the cortex that is lined with gray matter. There are two types of schizencephaly, open-lipped and closed lip. Closed lip describes the apposition of the two sides of the cleft, while in open lip there is CSF separating the two sides. Schizencephaly is caused by abnormal neuronal migration due to an in utero ischemic insult in the germinal matrix at between 30 and 60 days gestation. 90% of schizencephaly is 26-month-old child had a skull X-ray as a part of skeletal survey for suspected non-accidental injury. Multiple intracistral ossicles were seen. Which of the following should be considered? A. Scurvy. B. Achondroplasia. C. Turner's syndrome. D. Down syndrome. E. Hurler's syndrome. 29 A. Premature baby girl born at 20. Germinal matrix at between 30 and 60 days gestation. 90% of schizencephaly is associated with an absent septum pellucidum. It can also be associated with abnormalities to the optic nerve in septo-optic dysplasia. 28 Answer. Answer D. Down syndrome. Intracistral ossicles or Wormian bones are common in infancy and are considered abnormal only if greater than 10 in number and 6x 4 millimeters or larger. Common conditions include rickets, osteogenesis imperfecta, pycnodysostosis, hypophosphatasia, hypothyroidism, and Down syndrome. 29 Answer A. Cariventral. 28 weeks gestation, was intubated for respiratory distress. On day 3 a cranial USS showed right periventricular flare and hydrocephalus. A month later, on a repeat cranial USS, there was diffuse cystic changes in the right periventricular region with dilatation of the right lateral horn. What is the most likely diagnosis? A periventricular leukomalacia B porencephalic cyst C intraventricular hemorrhage D encephalitis E meningitis 30 A23, year, old woman. Pycnodycystosis, hypophosphatasia, hypothyroidism, and Down syndrome. 29 Answer A. Periventricular leukomalacia. Risk factors for germinal matrix hemorrhage are prematurity, less than 3-2 weeks, low birth weight, males, multiple births, prolonged labor, and cyanotic heart disease. It typically occurs within the first 2 days of birth. The germinal matrix lies in the caudothalamic groove and is very metabolically active, which makes it sensitive to low levels of oxygen. There are 4 grades of intraventricular hemorrhage as shown in the table below. A common finding in premature babies is flare within the periventricular white matter. Periventricular leukomalacia is the sequelae of ischemia in the watershed areas. Eventually the cystic areas are reabsorbed and ventriculomegaly occurs. 30 Answer D. Neural tube defect. Woman was undergoing an anomaly scan at 16 weeks gestation. Her maternal alpha-fetoprotein level was very high. An obstetric USS demonstrated the banana sign and the lemon sign. What is the most likely cause? A schizocephaly B holoprosencephaly C meningitis D neural tube defect E septo-optic dysplasia 31A38. Defect. The banana and lemon sign are seen on ultrasound in patients with neural tube defects. The head appears lemon-shaped at the level of the lateral ventricles due to bilateral indentation of the frontal lobe cortex, which is typically seen before 24 weeks. The banana sign is obliteration of the posterior fossa and herniation of the cerebellum. Benasarov BR, strike. "38-year-old male with a known left parietal AVM presented with ataxia and progressive hearing loss. A CT, pre- and post-contrast, did not reveal any new abnormality apart from the known AVM. On the MRI T1 and T2, weighted images showed cerebellar atrophy, and flare sequences revealed a hypointense rim along the cerebellar margins and the brainstem. What is the most likely diagnosis? A meningitis B chronic subarachnoid hemorrhage C leptomeningeal metastases D subdural abscess. E meningiomatosis 30. Signed indirect sign of spina bifida. Radiology. 1989, 171, 151-3. 31 Answer B. Chronic subarachnoid hemorrhage. MR imaging findings of chronic subarachnoid hemorrhage are pathognomonic. T2, weighted and gradient echo susceptibility imaging reveal characteristic hypointensity along the pial surface/subarachnoid space of the brain and spinal cord. This finding is detected classically along the surface of the brain stem and cerebellar vermis. Superficial side RASes of the CNS due to chronic, recurrent subarachnoid hemorrhage classically manifests with progressive bilateral sensorineural hearing loss, although ataxia and pyramidal signs are also observed. Underlying causes include vascular malformations, neoplasms, and trauma. HSUWC, Lovner LA, Foreman MS, ETA. Meningiomatosis 32A55, year. "55-year-old male was brought in unconscious following a house fire. He was intubated and had a CT head, which was unremarkable. 3 days later he did not regain consciousness, and an MRI head was performed. This showed low signal intensity on T1, weighted images, and high signal on T2, weighted and flare images within the medial portions of the globus pallidus bilaterally. What is the most likely diagnosis? A hypoxic ischemic encephalopathy B carbon monoxide poisoning C centropontine myelinolysis D venous infarction E Wilson's disease 33. Multiple cavernous malformations. AM, Neuroradiol. 1999, 20, 7 1245 to 8. 32 Answer B, carbon monoxide poisoning. Carbon monoxide poisoning is a leading cause of accidental poisoning. In the brain, has a predilection for the globus pallidus. On CT, there is symmetric hypodensity, while on MRI the medial portions of the globus pallidus appear as areas of low signal on TI and high signal on T2 and flare images. The caudate nucleus, putamen, and thalamus are occasionally involved. The differentials include Wilson's disease and cyanide poisoning. Chung-Ping Lo. E. Wilson's disease 33A55, year, old female was admitted with a short history of headache and drowsiness. She was found to be hypertensive with a BP of 220/140. On ophthalmoscopy, she was found to have grade 4 papilloedema. Pres, posterior reversible encephalopathy syndrome, was suspected clinically. What features would be expected on CT? A periventricular low-density white matter changes perpendicular to the lateral ventricles. B. Low-density white matter changes within the occipital lobe. C. Intraparenchymal hemorrhage affecting the basal ganglia. D. Low-density changes affecting the cerebellar white and gray matter. E. Diffuse bilateral asymmetrical perivenous low-density changes 34. Poisoning, early and late complications. R&J Rentgenol. 2007, 189, for W205-11. 33 Answer B, low-density white matter changes within 34A 53 year. Within the occipital lobes. The imaging pattern of PRES is seen in eclampsia, cyclosporin toxicity following transplantation, autoimmune disorders like SLE and Wegener's, and in hypertension. The exact cause is unproven, but an unstable blood pressure is a frequent finding. Typical findings in PRES include reversible vasogenic edema in the parieto-occipital, posterior frontal, and cortical and subcortical white matter. The cerebellum and brainstem are less commonly involved. Hemorrhage and restricted diffusion on DWI are atypical. McKinney A.M. Fifty-three-year-old patient underwent investigation for an incidental neck lump. CT demonstrated a 1 cm lesion at the carotid bifurcation, which was a homogeneous lesion with avid post-contrast enhancement. A typical salt and pepper appearance was seen on MRI. What is the most likely diagnosis? A schwannoma carotid body tumor. Regions of involvement and imaging findings. A.M. Röntgenal. 2007, 189, for 904 to 12. 34 Answer B, carotid body tumor. Carotid body tumors, paragangliomas, typically present as a firm mass below and behind the angle of the jaw. They display low signal on TI and high signal on T2 with multiple large flow voids. Avid enhancement is seen with splaying of the ICA and ECA. Up to 5% are bilateral and 6% undergo malignant change. Differentials include enhancing metastases from renal and thyroid primaries. 35 Answer A, bilateral thalamic infarcts. Neurofibroma 35A 35-year-old woman presented with headaches and left-sided weakness. CT showed hyperdense venous sinuses. On MRI there was high signal within the superior sagittal, straight, and right transverse venous sinuses. What further complication is she at most risk of? A bilateral thalamic infarct B. Imaging features suggest deep venous sinus thrombosis. Thrombosis of the deep cerebral veins may cause relatively symmetric infarction of the basal ganglia, thalami, and midbrain. Involvement of the gray-white matter may occur in a non-arterial distribution. Hemorrhagic transformation may occur, and brain swelling occurs earlier than in In arterial infarcts. 36 Answer C. Cerebral hypertension. Intracranial. 36 A 40-year-old man was making a good recovery following drainage of post-traumatic large-volume extraaxial bleeds. He suddenly deteriorated 24 hours following surgery, and a repeat CT did not demonstrate reaccumulation of the bleeds. Bilateral tentorial hygromas were seen. MR showed inferior displacement of the midbrain and crowding of the suprasellar cistern. Following contrast, there was strong enhancement of the dura. What is the most likely diagnosis? A meningitis, B subarachnoid hemorrhage, C cerebral hypertension, D diffuse cerebral edema, E venous sinus thrombosis. 37 A 4. Intracranial hypertension syndrome results from inadequate CSF pressure to support the brain in the skull vault, causing the brain to sag onto the skull base. The primary form probably arises from spontaneous arachnoid tears, while the secondary form is associated with trauma, post-lumbar puncture, and dehydration. MRI is the imaging of choice and shows tonsillar/insular herniation, bilateral subdural hygromas, and depression of the optic chiasm. Characteristically, diffuse dural enhancement is seen secondary to dural venous dilatation that occurs with reduced CSF volume, Monro-Kelly rule. E venous sinus thrombosis. 37 A 42-year-old female presented with intractable facial pain. A diagnosis of trigeminal neuralgia was considered and an MRI was performed. On high-resolution CISS sequences, vascular contact with the root entry zone was evident. Which vessel is most likely involved? A superior cerebellar artery, B posterior inferior cerebellar artery, C anterior inferior cerebellar artery, D basilar artery, E vertebral artery. Rentgenal. 1995, 165, 61513-15. 37 Answer A. Superior cerebellar artery. The SCA is the most commonly implicated vessel in trigeminal neuralgia. Other major arteries that may be responsible include the AICA, basilar, and vertebral arteries. Vascular contact is best depicted on MR, which clearly delineates the cisternal course of the fifth nerve. In the symptomatic patient, vascular contact at the root entry zone is suggestive, but not necessarily diagnostic, as a high incidence of vascular contact, and even deformity is seen in this region in asymptomatic patients. Treatments include microvascular decompression, radiofrequency rhizotomy, and injection of the trigeminal, gassarian, ganglion with glycerol. A young male presented with symptoms of neck pain and ipsilateral headache following a weekend of rock climbing. Signs of ipsilateral Horner's syndrome were also elicited. Following an MRI, a diagnosis of carotid artery dissection was made. Which segment of the carotid artery is most likely to be involved? A cervical segment, B petrous segment, C lacerum segment, D cavernous segment, E supraclinoid segment. (767 to 70). 38 Answer A. Cervical segment. Carotid artery dissection is known to occur after seemingly trivial trauma. Partial Homers is present in less than 50% of patients, and ipsilateral persistent headache is common. It accounts for up to 25% of strokes in the young and middle-aged patients. The extracranial portion is more commonly involved, cervical ICA at C1, C2, 60%. Dissection of the intracranial portion is relatively rare, as the skull base absorbs most of the force. E. supraclinoid segment 39A 56. Old man was investigated for intermittent arm claudication and gait problems. A recent Doppler scan performed as part of an insurance checkup had shown no disease in the carotids, but did show flow reversal in the left vertebral artery. An angiogram was performed which revealed occlusive disease in the left subclavian artery origin, with flow reversal in the ipsilateral vertebral artery on delayed images. What is the most appropriate treatment? A. Open endorectomy. Endorectomy. B. Endovascular endorectomy. C. Surgical bypass with vein graft. D. Balloon angioplasty. E. Endovascular stent placement. Answer E. Endovascular stent placement. The condition described is subclavian steal syndrome, which is a term used to describe retrograde blood flow in the vertebral artery associated with proximal ipsilateral subclavian artery stenosis or occlusion. Most patients remain asymptomatic, while a few develop neurological symptoms following use of the ipsilateral arm. The left subclavian is 3 times more commonly involved than the right, and atherosclerosis is the underlying cause. Endovascular management is common with a technical success rate of 86 to 100%, and primary stenting of the subclavian artery is the procedure of choice. 40 Answer D. Multiple bilateral small cysts within both parotid glands. E. Endovascular stent placement. 40 year old homosexual man went to a gum clinic with penile warts. He reported having unprotected sex with multiple casual partners. An HIV test was positive and his CD4 count was 300. He complained of painless swelling of his parotid glands and an MRI was performed. What would you expect to see? A diffuse generalized enlargement of the parotid glands. B. Multiple normal-sized lymph nodes. C. Diffuse heterogeneous low signal with increased vascularity. D. Multiple bilateral small cysts within both parotid glands. E. Diffusely enlarged glands with microcalcification. E. Endovascular stent placement. 40 year old homosexual. Choice. 40 Answer D. Multiple bilateral small cysts within both parotid glands. Benign lymphoepithelial cysts are painless cystic swellings of the parotid gland seen in HIV-positive patients. The condition is bilateral in 20% of patients. The cysts originate from lymph nodes within the parotid gland and are typically small, multiple, and in the superficial lobes. They have the typical imaging features of cysts. A year old girl presented after her parents became aware that her walking was slower than usual and she kept tripping over. On examination, she had an ataxic gait and bilateral reduction in toe proprioception. MRI brain and spinal cord were performed and showed atrophy of the cervical spinal cord without evidence of cerebellar atrophy. Which of the following is the most likely diagnosis? A. Ataxia telangiectasia. B. Guillain-Barré syndrome. C. Multiple sclerosis. D. Friedreich's ataxia. E. Joubert syndrome. 42. Imaging features of cysts. 41 Answer D. Friedreich's ataxia. Friedreich's ataxia is the most common inherited progressive ataxia. It usually presents before adolescence. The cerebellum is atrophied in ataxia telangiectasia, and the cerebrum is atrophied in multiple sclerosis. Guillain-Barré would not produce any cervical changes. 42 A 15-month-old child was placed under the care of social services for suspected child abuse. She had had a CT scan age 6 months, which was normal. A repeat CT scan demonstrated a defect in the right temporal bone with indistinct scalloped margins and a prominent CSF space lying adjacent to it. There was right temporal encephalomalacia. What is the likely diagnosis? A dermoid cyst. B. lacunar skull. C. New fracture. D. leptomeningeal cyst. E. Accessory suture. 43 A 5-month. 42 Answer D. Leptomeningeal cyst. A leptomeningeal cyst or growing fracture occurs in 1% of all pediatric skull fractures. It is seen in fractures associated with dural tears where arachnoid herniation and CSF pulsations produce fracture diastasis. Typical appearance is of a skull defect with indistinct scalloped bony margins. Usually evident 2 to 3 months after the injury. Gliosis of the adjacent brain parenchyma is common. 43 Answer B. Metaphyseal corner fracture of the tibia. The fractures considered to have a high specificity for abuse are metaphyseal fractures, posterior rib fractures, scapular fractures, fractures of the outer end of the clavicle, complex skull fractures and bilateral fractures. 5-month-old baby girl was admitted. Fitting. On non-contrast CT, had a crescent-shaped extra-axial mixed-density collection was seen. No history was forthcoming from the parents. What other pathology would most help you to clinch the diagnosis? A subconjunctival hemorrhage. B. Metaphyseal corner fracture of the tibia. C. Diffuse periosteal reaction of the tibia. D. Anterior rib fractures. E. Bruising to the forehead. 40 for a 3-month-old baby. Fractures or fractures of differing ages. Retinal hemorrhages occur in shaking consequent to high central venous pressures. Periosteal new bone is a benign entity in infants between 6 weeks and 6 months. It occurs symmetrically in the diaphysis, never extends to the metaphysis, and shows normal uptake on isotope bone scan. Three-month-old baby presents with intractable crying and respiratory distress. The patient has a facial CT scan, which shows a bony septum extending across the posterior choanine. Which of the following additional features are likely to be seen? A 5 mm wide posterior choanine. B. Outward bowing of the posterior maxilla. C. Thickening of the vama. D. Absence of the vama. E. 1 cm. Rao P. Cardi H. Non-accidental injury. Review of the radiology. Clin Radiol. 1999, 54, 111-24. 44 Answer C. Thickening of the vama. The diagnosis is choanal which is the commonest cause of neonatal nasal obstruction. This is a life-threatening condition, which is more commonly bilateral. It usually presents with respiratory distress, as babies are obligate nasal breathers. Bony septations are present in 85 to 90% of cases, the remainder being membranous septations. Further imaging findings include inward bowing of the posterior maxilla and narrowing of the posterior choanine to 3.4 mm in a child less than 2 years. 1 cm, wide posterior choane 45A 46, year, old HIV-positive female with a CD4 count of 40 cells/cum was admitted with a month's history of progressive confusion. A MRI was performed which demonstrated bilateral, asymmetrical patchy white matter changes with no mass effect or enhancement. What is the most likely diagnosis? A progressive multifocal leukoencephalopathy, B toxoplasmosis, C lymphoma, D HIV. 45 Answer A, progressive multifocal leukoencephalopathy. Progressive multifocal leukoencephalopathy is caused by JC virus and results in destruction of the oligodendrocytes, resulting in demyelination. It affects the white matter anywhere in the brain in HIV patients and is often bilateral but asymmetrical and is not associated with atrophy. Death typically occurs within 6 months. The white matter lesions do not exhibit mass effect and show minimal enhancement. Lymphoma and toxoplasmosis are more commonly discrete ring-enhancing lesions. CMV typically results in patchy diffuse periventricular white matter changes. Human immunodeficiency virus produces a 46A27, year, old HIV-positive man was admitted with increasing confusion and lethargy. He had a CD4 count of 150, but had no history of an AIDS-defining illness. Cross-sectional imaging of the head was performed. What features make a diagnosis of toxoplasmosis more likely than lymphoma? A corpus callosum involved B hemorrhage on CT, C basal ganglia lesions, D single lesion, E subependymal spread 47A4. 46 Answer B, hemorrhage on CT. Differentiating toxoplasmosis and cerebral lymphoma can be difficult as both can present as multiple ring-enhancing lesions. Features that are more likely to represent lymphoma are single lesions, subependymal spread, and lesions within the corpus callosum. Features that are more likely to represent toxoplasmosis are hemorrhage on CT and high signal on T2W imaging. Toxoplasmosis has a predilection for the basal. A 4-year-old boy was being investigated for short stature and diabetes insipidus. On CT, there was a rounded cystic solid mass with some peripheral calcification in the suprasellar cistern with peripheral enhancement after administration of iodinated contrast. What is the most likely diagnosis? A pituitary adenoma, B germinoma, C optic chiasm, glioma, D craniopharyngioma, E Rath's cleft, cyst 4 has a predilection for the basal ganglia, but lymphoma can also be found in this region. 47 Answer D, craniopharyngioma. Craniopharyngiomas have a bimodal distribution with 3/4 occurring in the first 2 generations and 1/4 within the 5th decade. Patient symptoms depend on the site of the tumor, for example, with diabetes insipidus when compression of the thalamus occurs or bitemporal hemianopia when compression of the optic chiasm. Tumors occur in the tuber cinereum, suprasellar and infrasellar regions. On CT, tumors appear as a cystic solid midline mass with peripheral calcification, and the solid portion enhances with contrast. On MRI, the mass is typically high signal on T1 and T2, weighted imaging with enhancement of the solid components with contrast. 48A35, year, old male was investigated for worsening progressive headache. On CT, there was a 5x6 cm cystic solid mass with heavy nodular calcification affecting the left frontal lobe. The tumor extended to the cortical surface with associated erosion of the calvarium. There was peripheral enhancement following administration of contrast. What is the likely diagnosis? A mucinous adenocarcinoma, B oligodendroglioma, C meningioma, D post-radiation changes, E glioblastoma, multiforme 49. 48 Answer B, oligodendroglioma. Oligodendrocytoma is a slow-growing grade 2 cerebral tumor that is more common in men aged 30-60 years. It has a propensity for the frontal lobes and involves both the cortex and white matter. On CT, there is heavy calcification within the tumor and surrounding vasogenic edema. Erosion of the inner table of the skull occurs, thus aiding the differential from meningiomas. There is variable enhancement with contrast. On MRI, the tumor is hypointense on T1W and hyperintense on T2, and flare except in the areas of calcification. 49 A 6-year-old female child complained of a worsening headache and vomiting. On CT, there was hydrocephalus and a lobulated soft tissue mass in the trigone of the right lateral ventricle, which enhanced brightly with contrast. What is the cause for the hydrocephalus? A overproduction of CSF, B obstruction at the foramen of Monro, C calcification. 49 Answer A, overproduction of CSF. This child has a choroid plexus papilloma. E obstruction at the foramen of Luschka 50A45, year, old male was being investigated for reduced hearing on the left. The left internal auditory canal was expanded by a soft tissue mass, which extended into the left cerebellopontine angle. There was minor calcification, and the mass showed strongly enhanced following for contrast. What is the most likely diagnosis? A meningioma, B acoustic neuroma, C epidermoid. 50 Answer A, meningioma. All the listed tumors. E arachnoid cyst 51A56, year, old man was being investigated. Tumors occur within the cerebellopontine angle, CPA. Both meningiomas and acoustic neuromas can cause expansion of the internal auditory canal and enhance brightly with contrast. Meningioma is the most likely because there is calcification within the lesion described. E arachnoid cyst 51A56, year, old man was being investigated for a right 7th nerve palsy. On CT, there was a lobulated heterogeneous hypodense mass extending across from the prepontine cistern to the right cerebellopontine angle mass causing compression of the right side of the pons. The mass was slightly hyperdense relative to CSF. What is the most common signal characteristics of this mass on MRI? A high signal on TI and low signal on T2B, low signal on T1, and low signal on T2C, low signal on TI, and high signal on T2D, high signal on TI, and high signal on T2E, intermediate signal on TI, and T2 52A 32-year-old Caucasian female with scan following worsening weakness of the lower limbs. 51 Answer C, low signal on T1 and high signal on T2. This patient limbs. Several discrete oval and round lesions were identified in the periventricular white matter perpendicular to the ventricles on MRI. A sample of CSF confirmed the diagnosis made on MRI. Which of the following is not a usual feature of this condition? A cortical lesion. 52 Answer B, hemorrhage. Demyelization lesions in multiple sclerosis typically occur in the periventricular region, perpendicular to the ventricle. Lesions can occur anywhere in the brain and affect both gray and white matter. Ring enhancement occurs up to 6 weeks after the occurrence of the plaque. Hemorrhage is not a feature. A periventricular extension 53A middle-aged alcoholic man was admitted with a reduced level of consciousness and quadriplegia. He had been discharged a few days earlier when he was noted to have a low sodium. On the most recent admission he had a CT, which appeared normal. A MRI, however, demonstrated a butterfly-shaped area of high signal in the pons on T2 and flare images. Similar lesions were also seen in the thalami. What is the most not a feature? 53 Answer B, central pontine myelinolysis. Central pontine myelinolysis, or osmotic demyelination syndrome, is acute demyelination secondary to rapid correction of a hypoatremia. It commonly occurs in diabetic 54 A 22-year diabetic patients with diabetic ketoacidosis, anorexics, and alcoholics. However, less common causes are SIAD, Wilson's, and craniopharyngioma. Patients develop symptoms a few days following the correction of the electrolyte imbalance, and presentation is varied from unconscious, locked-in syndrome, spastic quadriparesis, and pseudobulbar palsy, or with extrapyramidal signs. High signal is seen within the pons on flare and T2W usually after a couple of weeks. There may be high signal in the basal ganglia, and this is typically bilateral and symmetrical. Prognosis is very poor with a mortality of approximately 90%. 54 A 22-year-old with widespread cutaneous lesions, axillary freckling, and multiple cafe and laic spots is known to have a neurocutaneous syndrome. What abnormality would you be most likely see on CT? A optic nerve glioma, B acoustic schwannoma, C hemangioblastoma, D subependymal astrocytoma, E subependymal nodules. Typically bilateral and symmetrical. Prognosis is very poor with a mortality of approximately 90%. 54 Answer A, optic nerve glioma. Tuberous sclerosis, neurofibromatosis 1 and 2, von Hippel-Lindau, Sturge-Weber, and hereditary hemorrhagic telangiectasia are all neurocutaneous disorders. The cutaneous lesions suggest this patient has neurofibromatosis type 1, NF1. Other cutaneous manifestations of NF1 are neurofibromas and iris hamartomas. Optic nerve gliomas are seen in up to 30% of 1M. In 1F2 the main cutaneous finding is cafe and laic spots. In patients with tuberous sclerosis there is adenoma sebaceum, shade-green patches, and subungual fibrosis. In hereditary hemorrhagic telangiectasia, there are cutaneous telangiectasia on the face and freckles on the lips. A port wine stain is seen in the distribution of a branch of the trigeminal. 55 A 43-year-old male underwent an MRI for evaluation of hearing loss. In the right cerebellopontine angle there was a well-defined mass, which was low signal on TI, high signal on T2, and low signal on flare with an intensity similar to CSF. There was scalloping of the bony margins. What would you expect the signal characteristics to be on diffusion-weighted imaging? A low signal B, similar signal to fat C, high signal D. Distribution of a branch of the trigeminal nerve in Sturge-Weber. 55 Answer A, low signal. This patient has a similar signal to the ADC map 56. You are called to perform a cranial ultrasound on a neonate who has been critically ill after birth with low APGAR scores. The baby has not progressed as expected and is lethargic and less responsive than hoped. On the ultrasound in the coronal view, a line of hyperreflective dots is seen under the lateral ventricles. Which of the following is the most likely diagnosis? A tuberous sclerosis. B congenital toxoplasmosis infection. C periventricular infarcts. D rubella. E congenital Cytornegalovirus infection affects up to 1% of pregnancies, but symptoms only occur in less than 10% of those infected. There are multiple manifestations including E congenital cytomegalovirus infection. 57 A 6-year-old girl with a repaired myelomeningocele at birth and hydrocephalus had an MRI scan to check the position of her VP shunt. Sagittal TI and T2 images demonstrated a small posterior fossa with tectal beaking and a cervicomedullary kink. What finding in the cervical spine would account for any recent onset of neurological symptoms? A cervical astrocytoma. B syringomyelia. C epidural abscess. D neurofibroma. E vertebral collapse. 57 Answer B, syringomyelia. The condition described is Chiari-2. This is associated with syringomyelia in 20% and hydromyelia 50%. Hydromyelia is distension of the central canal, while syringomyelia is CSF dissection through the ependymal lining to form a paracentral cavity. Imaging appearances are indistinguishable, and the entity is often grouped together as syringohydromyelia. Syrinxes also occur in Chiari-I and can be associated with spinal trauma, intramedullary tumors, and extramedullary compressive lesions. Collapse. 58 An MRI of the thoracolumbar spine in a 26-year-old Morchio syndrome 59A29, year, old heroin addict presented with sudden onset left-sided leg pain. An X-ray of the lumbar spine was performed followed by an MRI, which confirmed the clinical suspicion of infective spondylitis. What features would you expect on the MRI? A narrowing of the disc space with high signal in the adjacent vertebral bodies on T1, weighted images. The narrowing of the disc space with high signal in the adjacent vertebral bodies on T2, weighted images. Bony remodeling and with slow-growing lesions. In NF1 it is secondary to dural neurofibromas or lateral thoracic meningoceles. 59 Answer B, narrowing of the disc space with high signal in the adjacent vertebral bodies on T2, weighted images. Early diagnosis is crucial in the management of infective spondylitis. Staphylococcus aureus is the most common pathogen. 60A20, year, old man had progressive upper and lower limb weakness, worse in the lower limbs. On MR there was widening of the spinal canal with posterior vertebral scalloping between D3 and D7. On TI and T2, weighted imaging a well-defined high-intensity mass was present anterior to the spinal cord with atrophy of the cord at this level. The CSF space was slightly expanded immediately superior to the mass. No high signal was present in the cord on T2. What is the most likely diagnosis? 60 Answer D, neurogenic cyst. The description above describes a chronic process resulting in bone remodeling and atrophy of the cord. Thus an epidural abscess and hematoma are unlikely. This mass is extramedullary but intradural. Although meningiomas and neuromas are intradural, they are isointense on TI, hence the best answer is a neurogenic cyst. Neurogenic cyst is an intradural mass. Meningioma 61A54, year, old female was scanned following insidious onset of bilateral leg weakness. MRI of the thoracolumbar spine revealed gibbous deformity centered at T10. Destructive changes were seen involving both anterior and posterior elements above and below this level with loss of vertebral body and intervertebral disc height. An epidural abscess was seen tracking down to L1 level. What is the most likely diagnosis? 61 Answer B, tuberculosis. Tuberculous spondylitis commonly occurs with an insidious onset in the thoracolumbar region with contiguous involvement of multiple vertebrae. Spread is usually via the hematogenous route, and the vertebral bodies are involved more commonly than the posterior elements. Destruction of the vertebral body leads to vertebra plana in children and gibbous deformity in adults. Pyogenic spondylitis is the major differential which occurs more rapidly with destruction, little new bone formation and usually sparing of the posterior elements. In brucellosis, lower lumbar involvement is common and bone destruction is associated with sclerosis. Epidural extension is minimal. Minimal. 62 Answer C, residual disc. Herpes simplex virus 62 following surgery for a herniated L4/L5 disc 66, year, old obese patient had little symptomatic relief. An MRI scan performed in the second. Common and bone destruction is associated with sclerosis. Epidural extension is minimal. 62 Answer C, residual disc material. Appearances of the postoperative spine can be challenging. In the early postoperative period, persistent symptoms are usually due to epidural hematoma, retained fragment, or recurrent disc. In the subacute and chronic stage the differential is mainly between a disc and epidural fibrosis. Osseous abnormalities depend on the specific surgical procedure. Epidural fibrosis occurs commonly, enhances with contrast administration, and the degree of enhancement varies with time since the operation, enhancing most strongly within a year following surgery. Neuritis, identified as intrathecal enhancement of nerve roots, is seen in approximately 20% of symptomatic patients. Early postoperative root enhancement is common in asymptomatic. Neuritis 63, a 46-year-old undergoing a CT of the abdomen and pelvis for small bowel pathology, was noted to have an abnormal-looking T10 vertebral body. This demonstrated some expansion within. 63 Answer A, hemangioma. Internal lucencies and areas of coarse trabeculation, the posterior elements were spared. An X-ray of the spine. EABC 64A35, year, old woman with a known spondylolysis and 50% spondylolisthesis presented with new onset lower limb weakness. She had an episode of vertigo 6 months previously, which had resolved. MRI of the spine demonstrated the spondylolisthesis and bilateral pars defects, but no cause for the symptoms was found. On flexion extension films the spondylolisthesis was found to be stable. What would be the next investigation you would suggest to the clinician? Vertebral hemangiomas are commonly incidental findings. Pain may occur and these become symptomatic if pathologic compression fracture or hemorrhage occurs. Plain X-rays demonstrate trabecular thickening and vertical striations while a polka dot appearance is seen on CT. On MRI the signal may be very. Osteoid osteoma, osteoblastoma, and ABC all involve the posterior elements. 64 Answer C, MRI brain. The MRI inflection lumbar. Clinician. A lumbar puncture B CT brain C MRI brain D nerve. Repeat the MR in 6 months 65 a 12-year-old with a webbed neck, low hairline, and a decreased range of neck movement underwent a CT of the cervicothoracic spine for surgical planning. Clinically, a diagnosis of Klippel-Feil syndrome had been made. Which of the following would not be an expected feature on the scan? 65 Answer C. Paravertebral ossification. A short neck, reduced cervical movement, and low posterior hairline are typical findings in Klippel-Feil syndrome, which usually affects the upper cervical region with fusion of vertebral bodies and posterior column. A fusion of 2 or more vertebrae be raised and rotated scapula. See paravertebral ossification. D. Omovertebral bar. Bari spinal stenosis 66 a 38-year-old male had a long history of back stiffness and restricted movement. Spinal X-rays followed by a CT of the thoracolumbar spine revealed flowing calcifications and ossifications along the right anterolateral aspect of the T7, T11 vertebral bodies. Disc spaces appeared preserved. What is the most likely diagnosis? A. Ankylosing spondylitis. B. Diffuse idiopathic skeletal hyperostosis. Rotation and elevation of the scapula due to an omovertebral connection. 66 Answer B. Diffuse idiopathic skeletal hyperostosis. Dish is characterized by diffuse flowing ossification. Primary osteoarthritis. 67 a 60-year-old man was being investigated for progressive bilateral leg weakness. And Mr. lumbar spine was performed on which multiple tortuous tubes with signal voids on the posterior aspect of the cauda equine were visible on both T1 and T2 weighted images. Subtle bumps were seen along the surface of the cord. The conus was expanded with high signal within it on T2. What is the likely diagnosis? A. Epidural hematoma. B. Epidural abscess. C. Cavernoma. D. Ossification of the iliolumbar and sacrotuberous ligaments. 67 Answer D. Spinal dural arteriovenous fistula. There are 4 types of spinal AVM: spinal dural arteriovenous fistula, type 1, spinal cord AVM, type 2 and 3, and spinal cord AV fistulas, type 4. Spinal AVMs present either with progressive sensory and motor loss or acutely following a sudden bleed, which has a significant mortality. Hemosiderin may be seen in the subarachnoid spaces reflecting previous bleeds. Spinal AVMs may acutely thrombose, and high signal within the cord is very common. Spinal cord arteriovenous malformations are intramedullary, while spinal dural and spinal cord arteriovenous Arteriovenous malformations are extramedullary but intradural. Treatment options are embolization, surgery, or both. Spinal cord arteriovenous malformation. 68 a 55-year-old woman complained of left retroorbital pain and double vision. On examination she was found to have left 3, 4 and 6 nerve palsies. She has no past medical history and is otherwise well. Imaging demonstrated abnormalities in the ipsilateral cavernous sinus and superior orbital fissure. What is the most likely diagnosis? A Moyamoya B. Ramsey-Hunt syndrome. C. Herpes simplex encephalitis. D. Tolosa-Hunt syndrome. E. Sarcoidosis. 60. Extramedullary but intradural. Treatment options are embolization, surgery, or both. 68 Answer D. Tolosa-Hunt syndrome. Tolosa-Hunt syndrome is an idiopathic inflammatory disease with some similarity to orbital pseudotumor. Patients present with recurrent bouts of retroorbital pain associated with cranial nerve palsies affecting the 3, 6, and 6 nerves. Symptoms last for days to weeks and respond rapidly to steroid therapy. The above features are typical. Ramsay-Hunt syndrome is due to herpes zoster infection involving the geniculate ganglion giving acute facial nerve paralysis, pain in the ear, and a typical rash. Sarcoidosis 69 An unwell 60-year-old man who is being treated for a large diverticular abscess was witnessed to have a grand mal seizure. He has felt generally tired recently and has a past medical history of colonic carcinoma for which he had an extended right hemicolectomy and hemihepatectomy. An MRI scan of his brain is performed which shows a ring-enhancing lesion. What imaging features would favor this lesion being a metastasis rather than an abscess? A cerebellar location B. Restricted diffusion on DWIC uniformly thick enhancing wall D. Thinning of the medial. 69 Answer C. Uniformly thick enhancing wall. Differentiating ring-enhancing metastasis and ring-enhancing abscesses can be difficult. Metastases typically appear as thick irregular ring-enhancing lesions within the corticomedullary region. Abscesses tend to demonstrate a thinner, more uniform enhancing wall. Abscesses point towards the ventricles and can demonstrate restricted diffusion. 70 Answer B. White matter of the centrum semiovaly. Human immunodeficiency virus causes encephalitis in 60% of patients with AIDS. It predominantly affects the white matter, particularly the centrum semiovaly, and results in gliosis and demyelinating plagues. These plagues are not dissimilar to plagues in multiple sclerosis, as they are in a periventricular position and high signal on T2 weighted images. Unlike plagues in MS, they tend not to enhance with contrast. Acute plagues in MS can enhance for up to 6 weeks after they first appear. Generalized diffuse parenchymal atrophy is a feature. Ophia CE. Evasogenic edema 70A27-year-old female with AIDS presented with a fit, and following further investigations, including CT and MRI scans, her symptoms were felt to be attributable to HIV encephalitis. Which region of her brain is most likely to be abnormal on the MRI scan? A. Anteroinferior aspects of the temporal lobes. B. White matter of the centrum. CE. Turnbull IW. The imaging appearances of intracranial CNS infections in adult HIV and AIDS patients. Clin radial. Centrum semiovaly C. Corpus striatum, putation.